I have just completed observing Sue Robinson complete an initial history on Mrs. Rodriguez. Mrs. Rodriguez was recently widowed and is having difficulty without her husband. Sue completed a history asking all the right questions of Mrs. Rodriguez about her social environment, home environment, and support systems. Throughout the assessment, Sue does not make eye contact with Mrs. Rodriguez, and she did not notice Mrs. Rodriguez's stress. Because of this, she did not recognize the difficulties that Mrs. Rodriguez is having with her husband's death.
Sue, I'm really glad I got to observe you taking Mrs. Rodriguez's history. Do you mind if we sit for a few minutes and discuss how it went? If it is okay with you, I would like to give you a bit of feedback on your performance.
Sure, I would love some feedback. Where should we start?
Before I give you my thoughts, I wanted to hear yours. How do you think the interview went?
Well, judging by what Mrs. Rodriguez told me and watching her, I do not think I had too many problems taking her history. It seemed straightforward to me. I think it was the first interview I completed by myself, so I was really focused on taking notes about everything she told me. I did not want to miss a thing.
I noticed that you took a lot of notes and you asked a lot of questions. That was well done. It is very important to ask enough questions and make notes of the patient's answer. You were also careful to take time with the client, which is good. That way she didn't feel rushed during the interview. Now there is one thing I noticed that could be improved upon your next interview. I noticed that Mrs. Rodriguez was visibly upset while she spoke about her husband's death. As a provider, we need to acknowledge feelings and address her appropriately. It also helps us to build a rapport with patients.
I was so focused on making sure I got a good history that I forgot to ask her how she was coping.
Don't be too hard on yourself. You're here to learn. What suggestions do you have to make sure you address your patient's emotions next time?
I will pause more in between my questions. Maybe try to be more sensitive too.
Those are great ideas. Also, next time, try to focus on developing eye contact, smiling, and ask about their interests and activities before the death of the spouse. It can be devastating for an individual to face their loved one loss. It takes a bit more observation and intuition on our part to go beyond the physical cognitive assessments to empathize. Overall, great job, Sue.